Morning, everyone. My name is Robert Beets, and I'm the program director at the New York State Association of County Health Officials, better known as NICE-HO. On behalf of NICE-HO, I want to welcome you to today's webinar, Strengthening School Health, Supporting School Nurses Through Local Immunization Action Plans. This session is co-hosted by NICE-HO, the New York State Education Department's Office of Student Support Services, and the New York State Department of Health's Division of Vaccine Excellence, better known as DOVE. We're so glad you could join us today. Our program will highlight the critical role of school nurses in promoting student health and ensuring immunization compliance. We'll also explore how local health departments can effectively support school nurses through their immunization action plans, or IAPs. During today's webinar, you'll learn the New York State Education Department's oversight of school health services, the technical assistance and resources available to school health staff, practical strategies for collaboration, and opportunities to strengthen partnerships that protect student health and improve immunization outcomes. A few housekeeping notes before we begin. All attendees are muted upon entry. We encourage you to type your questions into the chat box at any time throughout today's presentation. I'll be monitoring the chat and will share your questions with our speakers during the Q&A session at the end. If time allows, we may also open the floor for verbal questions. Today's session is being recorded. A link to the recording will be shared with all attendees along with the PDF versions of the slides, and we will also be posting the archive link to the New York State Department of Health's Learning Management System. And now I'm pleased to introduce our first speaker, Jennifer Wolfhart, a BSN RN. She's the public health nurse from the Bureau of School Immunization's Division of Vaccine Excellence at the New York State Department of Health. Jennifer has worked for the New York State Department of Health since 2022 after working for several years in pediatric critical care. She is currently a public health nurse with the Bureau of School Immunizations. She is passionate about sharing her expertise and collaborating with others and loves being a friendly resource to all who need it. Jennifer, thank you so much for being with us today. I'll now turn things over to you.
Okay, so as Robert said, I'm Jennifer. I'm a public health program nurse with the Division of Vaccine Excellence, Bureau of School Immunizations. Today, we're going to talk briefly about the IEP and how you can support your school nurses through your IEP, go over our requirements, the laws and regs, our medical exemptions, the post-secondary requirements, laws and regulations, the survey, some resources, our shared email box, and some external contacts. So there are, I know there's some new people on, but this is basically the school portion of the IEP. There's 3 performance measures. The first one is non-responders. You will get a list from the state with schools that did not respond to the survey, which we will talk about further. The next one is school and post-secondary immunization survey. Again, just talking about the survey, what is the survey, educating schools on how they can complete the survey, and then finally are the childhood immunization school and healthcare provider education. This one's pretty broad. There's a lot of flexibility on that. So how to support your schools through IEP. So I just want to note that your first point of contact for any IEP questions should be your regional rep. If you don't know who your regional rep is, you can always put something in chat or email us and we can connect you with that person. Our pre-K through 12 requirements are available online. It is a 2-page PDF. It's public. This year, we were able to translate it into 16 languages. We're working right now to hopefully get a 17th language approved and maybe even next year have more. I know that translation's a big struggle for all counties statewide every year, but we're working on it. But this is just going to be pretty basic things that you can show your school nurses and how to access them. Our public health law is available online in 2 different formats. One is a little bit easier to read than the other. We reference this a lot in court cases, not we as in me, the legal department. So it's very important that you know, if someone has a question that you give them a reference so you can tell them where you found it from. Our New York Codes Rules Regulations, Section 66.1. Again, this is basically a deeper look into the public health law, and it's once you kind of get the hang of reading it, It's actually pretty nice resource. I think someone's drawing on the screen. I don't know if Robert, if you can help me with that. Medical exemptions, this form is known as DOH 5077. It must be signed by an MD or DO licensed in New York State. It's up to the principal or person in charge whether they want to accept or deny a medical exemption. That's a question we get quite a lot because oftentimes you'll see a contraindication listed that's not actually a contraindication to a vaccine. Of course, we want to educate the school on what contraindications are and if there's a reason that it shouldn't be accepted. So we do recommend sending them to the state. Our medical director will review it, make a formal recommendation. But if the school chooses to accept the medical exemption after the state recommends denying it, it is within their right to do so. But if you come across a medical exemption that doesn't look right, you can always ask the school. You know, we have stop backs fraud you can send things to, but if it meets the requirements, you know, technically it can be accepted. If you're seeing a provider that's writing repeat medical exemptions, we would want to be notified of that. We have reported some providers to OPMC who have written the same medical exemption like 30 times. So if you have any questions about that, of course, our email address is where you would send it to. The survey. The annual survey is required by public health law. You may be instructed to call non-responders to the survey as part of your IEP. If any schools have questions about the survey, if they have questions on technical support, they can email our email address. Some resources. Currently, we don't offer translation services. Again, we are working on getting money for that. But there are some resources available online that we've referred people to previously. The Minnesota Department of Health has a free vaccination record translation service. They added a couple of new languages this year. And then just our website, this will link to our website. We have a lot of great resources on there as well. And all of these things you can give to schools as part of educating them through your IEP. Our shared email box, osas@health.ny.gov, is a public-facing email address. Any questions about medical exemptions can go through there. Questions about school immunization requirements that come from school nurses, administrators, or providers, and any type of survey assistance such as HCS account help if they don't know how to complete the survey or anything like that. And then some contacts on here. We have our email address, NICES. We get a lot of random questions about NICES obtaining records. They do have a way to make a school list in NICES or NICES access for school nurses, things like that. Our phone number, NICES Student Support Services, who's going to be speaking today, and then the New York City Department of Health and Mental Hygiene. Any IEP questions specifically or other parts of the IEP that don't have to do with schools can go to your regional rep.
So our next presenters are Ann Lanou and Karen Hollywood. Ann Lanou, RN BSN MBA, Ann is the Associate in School Nursing with the New York State Education Department's Office of Student Support Services. She joined NICED in 2019, where she focuses on a wide range of school health issues, including regulations, policy and guideline development, health education, HIV, suicide prevention, and oversight of the Youth Risk Behavior Survey and school health profiles. Ann brings over 40 years of nursing experience to her role. Her career has spanned hospital nursing, public health, and nursing leadership. Before joining the state education department, Ann spent 14 years as a school nurse covering grades K through 12 and served as director of nursing during the last 5 years of her school-based career. She's passionate about school health and always says there's no better place to be than in a school, where students keep you on your toes. And joining her is Karen Hollywood, RN BSN MSED, supervisor of the Student-Centered Education Policy Unit at the New York State Education Department's Office of Student Support Services. Karen joined NICED in 2008 as an associate in school nursing and brings with her a deep and diverse background in both health and education. She has worked as a registered nurse in public and community health, critical care, discharge planning, and case management. She's also a certified teacher in special education and reading, and previously taught at the elementary level. In her current role, Karen leads the Student Centered Educational Policy Unit, overseeing a wide range of programs that directly impact students' lives. Her portfolio includes mental health, school health services, school safety, the Dignity for All Students Act, foster care, enrollment and attendance policies, social emotional learning, and education for students in home, hospital, or institutional settings. With more than 17 years at the department, Karen brings a wealth of knowledge and a strong commitment to advancing student well-being through school health policy. Ann and Karen, thank you so much for being here.
Thank you, Robert, for that great introduction. It makes me sound a little bit ancient. I'm not that old. Close, but not that old. Welcome, everybody. Happy Tuesday. We are here to support you in any way we can. We are from the Office of Student Support Services through the Education Department. School health services programs are required in all public schools. They're governed by Education Law Article 19, along with other state and federal laws. Public schools are required to provide school health services in non-public schools upon request. So we are in the Office of Student Support Services. We are actually 3 RNs. Andrea Vink is also an associate in school nursing, and she's helping us out today as well. We have 731 school districts that we're responsible for, 1,799 non-public schools, 372 charter schools, 2 state schools, an awful lot of students, a lot of school nurses that are registered nurses, and several hundred LPNs. So school health services programs are not school-based health centers. That's something totally different. A school-based health center is a privately run clinic located in a school for students whose parents and guardians have enrolled them, almost like a doctor's office renting space at a school. For many students in New York State, the school health office is the only time they see a healthcare professional on a regular basis. School health professionals provide physical exams and screenings, assistance with obtaining health insurance or finding a healthcare provider. They counsel parents, guardians, students on health issues, as well as teachers, and are on the forefront of public health issues. Many students come to school with underlying health conditions that require school health services for them to fully participate in school. These include students with diabetes, asthma, seizure disorders, mental health disorders, and those who need routine medications administered and monitored for effect. The CDC estimates about 40% of school-age children have at least one chronic health condition. The NYSET area of school health services, again, is staffed by 3 experienced registered nurses. So school health services is a program dedicated to serving and supporting health professionals in all pre-K through 12 schools. So school health professionals have the necessary tools to provide exceptional health services in the school setting within relevant legal framework. So NYSET contracts with the New York State Center for School Health. You're going to hear them a little bit later. The center is a technical assistance center, or TAC, of NYSET, and is a valuable resource for school health professionals. So when we say school health professionals, we're talking about the registered nurses that are in schools, we're talking about the LPNs that are in schools, and we're talking about the school medical directors, as well as school administrators and other school health professionals. So NYSET School Health Services develops guidance documents that provide the legal guardrails which assist school health personnel in their practice. The guardrails ensure safe practice and the well-being of students. This is an outline of what happens with school health services. So there's education laws. From education law comes commissioner's regulations. They all frame school health services. From education law and commissioner's regulations, we develop guidelines, policies, and memos that assist school health personnel. School nurses and school medical directors use the guidelines to provide the care that they need to for students. There's also other duties as assigned. I'm sure you're all familiar with that. And we can help schools with school health services with that as well. They may be situations such as AED or mental health or Medicaid in schools, the dental certificates that are asked for. So those are kind of other things that we can assist with as well. Okay, so school health services are to be provided to all students by each school district. Article 19, Section 901 is the bare minimum for what school health services need to do. We live by Article 19. Please note that there are many more, there is way more that you'll need to do as a school nurse, and way more that they do. So school health services personnel provide recommendations concerning health and safety aspects of school buildings and grounds. For example, and this is from my experience as a school nurse, we had a science teacher who received a grant to put in, was like a window that had a beehive. So the bees would come in from the outside and the students were able to see how the beehive was created and et cetera. The problem being with that was that there were children in the classroom that had allergies to bees. So we were asked to come in, the school nurses were asked to come in and kind of brainstorm with the teacher and administration to help with that situation. So as a school nurse, you do pretty much a little bit of everything. So we also work within the guidelines of federal laws. So there are federal laws and state laws that impact health services in schools. So FERPA is the federal law that protects the confidentiality of personally identifiable information. FERPA permits or gives parents, guardians, the right to have access to their children's education records, the right to seek to have the records amended, and the right to have some control over the disclosure of personally identifiable information from the education record. HIPAA, I'm sure you're all familiar with HIPAA, is the Health Insurance Portability and Accountability Act of 1996. HIPAA is a federal law that required the creation of national standards to protect sensitive patient health information from being disclosed without the parent's consent or knowledge. Pretty much everything that's done in school health requires parent or guardian consent. HIPAA doesn't apply to schools except for the billing transmission sent from a school for a student with IEP who has Medicaid. We also, state laws, as I said earlier, we rely on Article 19. That's your go-to place for health services information. We also rely on Education Law Article 139, which applies to the profession of nursing. Education Law Article 137, which applies to the profession of pharmacy. Education Law Article 131, which applies to the profession of medicine. Section 2164, which, as Jen had said earlier, provides information on immunization law and regulation. And Section 3000, which covers emergency medical treatment, automated external defibrillators, and EpiPens. And we also rely on an awful lot on Social Services Title 6, which is related to child protective services and mandated reporting. So those are all laws that, and there's more, that we look to for guidance. So just to illustrate how complex and challenging school nursing can be, there are 4 laws around the administration of epinephrine that affect how a school can use and assist a student or staff member who requires or needs epinephrine. The school health personnel need to know each law, how it applies, and what they need to do to ensure working within the law and student and staff safety. Now I'll turn it over to Karen.
So there are, as Ann said, a multitude of laws. The first one, the most common one, is Education Law Article 921, which allows nurses and unlicensed people to be trained to administer an epinephrine autoinjector to a student who has a patient-specific order for such. And if you click next, we should see the next one. And Commissioner's Regulation 136 goes along with Ed Law 921 and mirrors the same language. Click next again. Then we have Ed Law 921A, That is a law that allows boards of education to determine whether or not they're going to allow unlicensed people to be trained to administer an epinephrine autoinjector to either a student or staff member in a building who appears to be suffering from anaphylaxis, regardless of whether or not they have a history of such. And then 136.6 of the Commissioner's regulations mirrors similar language in a little more detail for that law. If you could click again. We also have Public Health Law Article 30, Section 3000C. That is correlated into Article 19, Section 921A. In other words, that 921A says that those persons who are trained have to be trained in accordance with Section Public Health Law Section 3000C. And the last click. We also have Public Health Law 25, Section 2500, which pertains to some of the information that we put out in our anaphylaxis guidelines that also has some more information on providing epinephrine in emergency situations. So this is just a brief listing of all the current guideline topics that we have available to schools. Just so you understand, and Anne alluded to it, we start out with a law. And then commissioner's regulations are developed based on that law. So commissioner's regulations can provide a little more detail, but cannot be contrary to the actual requirements in the law. And from the commissioner's regulations, SED will create these either guidelines, regulation, policies, and memos to put out to the field to try to explain to them all of these laws. And it gets very complex. These guidelines, by the way, are available on both our website, which we listed at the bottom of the slide, and also our Technical Assistance Center's website, which you'll see coming up soon. So the Director of School Health Services is the official title that's used for the medical director, which is a commonly used title. We rarely will hear someone mention Director of School Health Services. This is the only health professional that's actually required to be employed by a school. And Director of School Health Services, aka medical director, must be a physician or a nurse practitioner licensed to practice in New York State. If you could click, what the first click should open. Yeah. So this just tells you these are mandated in public schools. So the duties of a medical director are in statute that they perform and coordinate health services in the public school, and they provide health appraisals, which is the fancy term for a health exam done in the school by the medical director, and that's for students attending public schools. So schools can employ a school nurse who must be a registered professional nurse as well as other health professionals. And what that first line really means is that only an RN can use the title school nurse. And all of these professionals aid the Director of School Health Services to perform their duties, including health instruction for the benefit, as long as it's within their scope of practice. School nurses. So everybody knows school nurses, and we have a lot of them in the state. If I think back to the slide 2, it was about 4,000 plus school nurses. And those are just the ones we know that are on our listserv. Because schools self-report their staff to us, it's not always accurate. So we don't always know if there are more out there that just didn't get reported. So school nurses are assisting the medical director in performing their duties. And since school nurses are RNs, they can assess, they can triage, they can follow non-patient specific orders. And I'm switching to my notes here. Unfortunately, we had a lot of technical difficulties here, so I don't have them front and center. We do say that LPNs are useful in school buildings where an RN might need support, but they may not be used as a replacement for an RN. We do have several memos that outline the differentiated scope of practice of the two nurses. Primarily, LPNs cannot instruct or supervise RNs or other LPNs. It is also important to note that schools do not always understand, the administrators, that only a licensed physician, nurse practitioner, midwife, podiatrist, dentist, clinical nurse specialist, or an RN can actually supervise nursing practice of an RN or an LPN. However, the administrators can supervise non-clinical practice, such as attendance, dress codes, anything that's related to being an employee of the school that's not clinical practice. We do want to point out that research has shown that for every dollar spent on school nursing, society saves $2.20, and this comes a long way to preventing lost time for parents of taking care of ill children who don't necessarily have to leave school because a school nurse can manage whatever the injury or the illness is occurring, prevents costly ER visits and such. Okay, so this is the meat and potatoes of why we're all here. So communicable disease or immunization questions are the meat and potatoes of the local health department, and that is a primary role of the local health department in assisting schools. We ask that the local health department nurses include the school nurse in any communication to us, or have the school nurses reach out to us directly on any questions, because as you could see, there are a lot of nuances to school health services. There are a lot of laws that may or may not be coming into play for a particular situation. And so it's just much easier for us to talk directly to the school nurses. These are the type of subjects that we deal with on a regular basis. And if you're getting questions at the local health department on any of these subjects, they should be directed to either our office or our technical assistance center, who's the New York State Center for School Health, who also has RNs on staff to assist in answering some of these questions. Direct communication, again, is the way to go, because so much gets lost when you're relaying messages back and forth for someone. And we also find that a lot of times mistakes are made because there's this little detail the RN didn't tell the local health department that we find out about that changes everything. And the next click, I think, just shows them the arrow for us. So basically what we're asking is, if the nurse isn't asking about something that's in your scope of practice for a local health department, that you direct them to us to avoid any errors, because as you can see, the amount of laws that impact school health are very different than any other clinical practice setting. And the two nurses that work with me can attest to take years to learn and to learn all the nuances. And in fact, they've been here 3 to 5 years each and still learning. And I've been here 17 years, still learning. So it is complicated, and that's why we ask that it gets sent to us directly. These are some of the things that we work with other agencies on that also impact some of the answers that we'll be giving to school nurses and other school personnel who ask our questions. So we collaborate on routine basis with primarily the Department of Health, the Office of Children and Family Services, the Office of Mental Health, and occasionally OASAS on a variety of topics that we listed here. And as a result of those collaborations, we also have very specific guidelines developed based on some of these subjects. And I'll just tell you, they're all listed on our webpage, but the New York State Guide for Asthma Management in School was developed in partnership with the Department of Health. Bloodborne pathogens in classrooms was also developed with the Department of Health. Concussion management guidelines also developed with the Department of Health. Influenza guidance is actually developed by the Department of Health and sent to us to send out to all the schools, because there's a law in the books that says schools must post information on influenza guidance every year in a readily visible location. Mental health education in schools was done in collaboration with the OMH. New York State Addiction and Substance Use Disorder Educational Resources is a huge document we did, primarily used by our health educators, and that was done with OASAS. And finally, the guidance for providing educational resources to address substance use was also done with OASAS, because there is another little law in the books that says if any student, community member, or staff members ask for substance use treatment information, there's a person in the school that is trained to provide that information, keep the contacts confidential, and provide the information. So there's a giant guideline on how to do that correctly. So this is the end of our presentation. So this is our phone number and our email address. We are always available to answer calls from the field or from local health departments, or for parents and from school attorneys. We run the gamut with all of those. And so anytime you're not sure what to do, feel free to reach out. That's what we're here for, in addition to everything else we do. And we always have one person available to try to answer phone calls on a pretty quick basis. We try to answer them within 24 hours.
Thank you, Ann and Karen. So our last speaker is Janet Fitzpatrick, a BSN RN. She is the Health Services Specialist from the New York State Center for School Health, Contract Office for the New York State Education Department. Janet is a bachelor prepared nurse with critical care management, athletic director, and school nurse experience. Janet joined the center in March 2023 as a health services specialist. She is a resource expert in school nursing, and she provides technical support and professional development for New York State school nurses, medical directors, and those providing oversight for school health care services pre-K through 12. Janet creates resources and consultation with the New York State Education Department Student Support Services team, consistent with New York State laws, regulations, and guidelines within the framework of a coordinated school health model. She believes that a student's health is directly connected to their ability to learn and effectively engage in school. She supports the center's goal of keeping New York State students safe, healthy, and ready to learn. Janet, thank you for being here today.
Thank you so much, Robert, for the introduction. Good morning, everyone. My name is Janet Fitzpatrick, and I am the Health Services Specialist with the New York State Center for School Health. On behalf of my colleagues, I want to thank you for the opportunity to present about who we are and what we do to serve and support school health personnel. The New York State Center for School Health is a really long title, and we often shorten it to NYSCSH, or the center. And as stated in Karen and Ann's presentation, we are a contract technical assistance center for the New York State Education Department, Office of Student Support Services. The center has been supporting the field for over 30 years. Our office is located at Monroe 2 BOCES in Rochester, New York. Our team includes 3 RNs, Melissa Trow, Kirsten Farden, and me. Shelley Badinsky, our certified health educator who supports health education throughout New York State, and Julie, our support specialist. We also employ a medical director, Dr. Ron Marino, who provides services to the center and state education department on a consulting basis. What we do and how we do it. We provide resources, professional development, and assistance in the coordination and collaboration in K-12 school health services throughout New York State. By support and assistance, professional development, resource development, coordination and collaboration with obviously State Education Department, CDC, the Department of Health, and other professional agencies. We also disseminate information. Our goal here at the center is to provide assistance referencing laws, guidelines, or regulations. And as important as providing the most accurate response is knowing when to refer questions to our leads at State Ed, or when the question is not ours at all and it should go to another appropriate agency. Why we do it? Well, we share a common goal, and it's to improve the opportunity for New York State students to attend school healthy, safe, and ready to learn. The health needs of students today have increased in scope and complexity, making the role of health services and school nurses an increasingly integral role in the school, ensuring the health and safety of students and staff. The following few slides review the different ways that we support schools. The center provides phone support 7:30 to 4:30 Monday through Friday. I mentioned earlier that we are located at Monroe 2 BOCES. When we are returning a phone call, please note that BOCES may appear on your phone, and this sometimes causes confusion. Email support 7:30 to 4:30 Monday through Friday, the same thing as above with our email addresses. They all contain monroe2boces.org. The center manages our website, which includes resources for both health services and health education. Our website receives approximately 26,000 visits per year. And then on the bottom of this slide, it just provides some of the question topics that we receive. How we do it, email subscription service. We manage an email messaging system known as the Health Information Portal, or HIP for short. HIP is a permission-based list overseen by the State Education Department. It is designated as the primary source for communicating up-to-date school health services and health education information. We disseminate information for State Education Department on updates and revisions to laws, regulations, guidelines, or other relevant communication necessary to assist schools in creating an instructional and supportive framework. We also send out relevant information from the New York State Department of Health and other professional and governmental organizations. Our membership currently reaches it's really close to 5,000 school health professionals. To stay up to date, we strongly encourage you to register using the link provided on our website. Please encourage school nurses and other allied school health professionals to sign up as well. In case you missed one of our emails, we HIP archive all of the emails sent from the center for the current and previous school year, and I will show you more on our next slide. On the left side of the slide is a snip of the HIP email sign-up page. Please note that when you are signing up, we ask that you choose the role, choose the link on the page that best describes your position. If you have multiple roles, you can subscribe to more than one. For example, a nurse practitioner may be the medical director and hold a part-time position as a school nurse. When sending out information to the field, we only send information to those who need to know, so not to clog up your email. And just as an FYI, the school medical director webpage is password protected. All school medical directors must subscribe to the HIP and have their information and credentials validated to receive their login information to access their specific medical director page. On the right side of the slide shows the HIP email archive page. And where it says 24-25 school year email archive messages, that is a button. And if that is clicked on, it takes you to all of the messages that were sent out in the previous school year. We switched the school year in July. So when you're going to look, it's not the calendar year, it's the school year from July to June. So as you can see, I started in September. There's nothing on there yet for September because it's not September, but we ask that you look at our site frequently because we do archive those and put them as they are sent. How we do it website. Our URL is www.schoolhealthny.com. Our website serves as a comprehensive library housing resources and providing links to other vetted websites and resources beneficial to schools and school health personnel. We update and review our website frequently, actually I'm going to say daily, to address changes in laws, regulations, and guidelines, as well as trending topics, best practices, repairing broken links, etc. A search feature is found at the top right-hand corner of every page to help you find the things that you need. Our homepage consists of our banner, and underneath, way at the bottom, there's news and calendars located as well. We update the news several times a week and the calendar frequently with educational opportunities on topics of interest for the field. Also, when there's an important information or a type of announcement, we will post a pop-up on our website. And just so you know, we just did a wonderful, beautiful website refresh. So if you click on our website now, or if you visit our website, you will notice a pop-up that appears. And in the lower left-hand corner, there's a place that you can click on that asks you if you don't want to see the message again. Also, another feature our website has is it can translate the web pages of our site into other languages. This feature is located in the upper left-hand corner. This feature only translates the web pages. It does not provide translation to forums, webinars, etc. How we do it, resources and professional development. We provide and create resources on topics related to health services, health education, and coordinated school health. They are sometimes created to provide clarification on a specific topic the field may find confusing. The Dominic Murray sudden cardiac arrest chart is a perfect example. We offer in-person and online professional development. In person at our annual school health seminar and online through our web-based learning, located in our learning management system. Our LMS houses required training such as epinephrine and glucon training for unlicensed personnel, as well as other professional development pieces such as sudden cardiac arrest, the impact of domestic violence on children, medication management in schools, and many more. We choose our topics based on survey results from our seminar, our web-based learning opportunities, LMS offerings, and/or topics and trends in the field. If there's a content topic you would like to learn about, please reach out and let us know. One of the best ways to support school nurses is to share our school nurse resource page. This slide only contains a small portion of the page. Whether someone is new to school nursing or has years of experience, the center has created this resource page full of invaluable information to provide support. It contains our frequently used resources, guidelines, and memos, as well as recommended webinars to help with the transition to school nursing. We have also included our frequently called numbers resource, which we recommend keeping nearby. It also provides information on how to sign up for our email subscription HIP to receive the latest updates. To make it easy for the field, a Contact Us button is located at the top of every website page, and our contact information is also located at the bottom of every page. Some helpful hints when you're contacting the center. When leaving a voicemail, please include your phone number with the area code and provide details about your call so we can have the necessary information ready and be prepared when calling you back. When emailing, please ensure your signature card in your email is updated and has a phone number with an area code. We may need to contact you for more information before we can reply to you. We encourage individuals seeking assistance to contact the center directly. Often we require additional information to provide the most accurate answer. The details they provide, even if subtle, may alter the response or be the deciding factor that the question needs to be sent to our leads at State Ed or another agency altogether. This is the frequently called numbers resource I was just speaking of. And is located on our Contact Us page and our School Nurse resource page. I will not bore you by reading all the contact information that we have on here, but we have updated this fairly recently to just be more inclusive of all the things that a school nurse or someone who is in school health services may need to contact. One thing I'd like to point out is that highlighted area at the bottom of the page. It says this resource is located, and if you click on that, it shows you where it's located. But we do date our documents. So when you are looking at a document, please verify that you are actually using the most current information. Thank you for attending. This collective webinar provided a lot of valuable information about each agency, where they intersect and where they differ. This can become cumbersome when trying to determine who to contact. One of today's key points are utilizing and sharing the contact information provided. Please remind the field not to struggle with wondering who to contact, but to just reach out with questions. Each of the agencies will either provide the necessary answers and resources related to their specialty or to direct to the correct agency for further assistance. We appreciate you joining us today. Thank you for your time and attention, and I am now going to pass things over to Robert to facilitate our question and answer session.
Thank you so much, Janet. So we are going to move into questions, and I have some questions here in the chat that have not been answered yet. The first is a comment. Once again, the amount of responsibility put on such a small number of nurses is astounding. The three of you are amazing to be able to even attempt to oversee such a large number of schools and students. What a great comment. Thank you for that. There was a question about the slides. Will they be available? Yes, we will be sending out a follow-up email later today or tomorrow that will include the archive recording link and today's handouts, as well as a link to the evaluation. And then there are some questions about regional reps, and I assume they're referring to Dove regional reps. So in chat, there's a question, who is the regional rep for Suffolk County? And then also, who is the regional rep for Buffalo and Erie County? So if Dove could just put those in chat, I would appreciate that. Our next question, has there been discussions at the Department of Health or Dove about giving access to the school survey application to IEP contacts so that they can assist schools' daycares with completing the survey? It's difficult to assist when we don't have access.
I can answer that one. Yes. Unfortunately, with the switch over to the new smart system, it is more selective as to who can have access, but we are working on ways that we can get more information to the LHDs. So feel free to reach out to OSAS, especially if you have some particular questions about schools in your district, and we can make sure that we get you all that information.
Great, thank you. Another question, could Dove send out a list of all districts and those IEP contacts statewide?
We can absolutely look into that.
Thank you. And another comment, I agree with Katie, it would be especially helpful for daycares who often do not have nurses working for them. So thank you for that. Any other questions in chat before I allow people to unmute? Okay, so at this time, you do have permission to unmute your line if you have a question. I do ask that you raise your hand first, and I see Victoria Cunningham, I believe you have your hand up. Feel free to come off mute. Anybody have a question? It's not every day we have all these people together. We still have about 10 minutes, so feel free to ask your questions. And thank you. I see that the regional reps were posted in chat, so thank you. Other questions? Okay, well, hearing none, I guess we'll go ahead and conclude today's session. I want to thank all of you for joining us today for our Strengthening School Health, Supporting School Nurses Through Local Immunization Action Plans. We hope the information shared was helpful and that you leave today feeling better equipped to support school nurses and enhance local immunization efforts. A special thank you to our incredible speakers for sharing their time, expertise, and insights. Your contributions are truly appreciated and vital to this important work. As a reminder, we will be sending out a follow-up email that includes the archive recording link, today's handouts, and a link to the evaluation. Please make sure to complete the evaluation. I want to make sure any future trainings we do under the immunization contracts are really beneficial for you. So please fill those out. Additionally, we are going to post the archive link to the Department of Health's learning management system, so you will be able to revisit the content or share it with your colleagues who couldn't join us live. And thank you again for everybody for your participation and for the work you do every day to strengthen school health in your communities. I hope you all have a great rest of your day and rest of your summer. Thank you, everyone.